Hi there, it's Justin Lubino again with Senior Advisors. And even though it's only August, we wanted to start giving a update on what's coming for 2018 with regards to Medicare. There's certain things that we aren't defined yet for 2018, but there's certain things that we do know, and we wanted to share those with you today. The first thing we're going to discuss is how Part D of Medicare is changing. Part D, again, is the prescription drug coverage. We did a video a couple years ago that explained the different parts within Part D of Medicare, and this is just a little update with regards to some of the values related to Part D of Medicare. The second thing we're going to talk about are the IRMA changes for next year. IRMA is income-related monthly adjustment that folks have to pay if they're in a higher income bracket for their Part B and their Part D premiums. So we're going to just discuss those as well here today. The things we don't know yet are what the Part B premiums are going to be for 2018, the Part B deductible, the Part A deductible and copays, as well as the actual Part D premiums. This is what you pay the insurance company for the prescription drug coverage. Some companies have already started to share what they're going to be charging in 2018, but we don't have all the information yet, so this will come in a later update when we get the other information as well. So the first change is Part D of Medicare, and this changes every year. So the actual structure here that you see is the same. If you look at my prior video from a couple years ago on Part D of Medicare, I went into detail on each one of these steps. You can review that again if you want a little more detail on how Part D of Medicare works. But basically, the things that are changing are in orange on this slide. So the annual deductible, this is the maximum amount that a carrier can charge for a deductible with the Part D of Medicare. This year in 2017, it was $400, and next year in 2018, it's going up to $405. So the plans don't have to charge the deductible. They can have a $0 deductible, they can have a $50 deductible, $200, but the maximum they can have next year is $405 for that deductible. After the deductible comes the initial coverage level. This is where the individual pays a copay or coinsurance for their medications. And the initial coverage level this year in 2017 was $3,700 based on the retail cost of the drugs. Next year it goes up slightly, just up to $3,750 based on the retail cost of the drugs. So basically what that does is it very slightly may delay when you hit the donut hole if you're on very expensive medications. It's only $50 difference. So if you're on expensive medications, that's going to have a very minimal impact as far as when you hit the donut hole, but it will have a slight impact, hopefully delaying when you hit the donut hole. The third step is the coverage gap. This is also called the donut hole. And in this third step, in 2017, the individual had to pay 40% for their brand name drugs. In 2018, that's dropping to 35%. And for generics, it was 51% in 2017. In 2018, it's dropping to 44%. So this is a positive. This continues to get, let's say, shrunk, the donut hole each year between now until 2020, and it will drop down to 25% in the year 2020 for both brand name drugs and generic drugs. So this is moving in the right direction. You're paying a smaller percentage of the cost of the drugs in the donut hole. Some might argue that the cost of prescription drugs continue to increase at such a rate that even though this is shrinking each year, it doesn't seem to really have a material impact on your costs because the cost of the drugs continues to rise at a equal or greater rate that the donut hole is shrinking. But that said, it is getting better from a donut hole perspective, going from 40% to 35% for brand name. In addition to that, the length of time that you stay in the donut hole is tied to this true out-of-pocket cost. In 2017, it was based on $4,950 true out-of-pocket cost. That's increasing only $50 to $5,000 true out-of-pocket cost. So in theory, you could remain in the donut hole for slightly longer because of that additional $50 before you hit the catastrophic coverage, which is when you exceed the $5,000 based on true out-of-pocket cost. The other change within catastrophic, again, this is the other side of the donut hole. It's there to protect you so you don't continue to have to pay those donut hole costs for the rest of the year. if you do happen to spend more than the $5,000 true out-of-pocket cost. The change here in catastrophic is the cost of a brand name drug went up 10 cents. It's the greater of 5% or $8.25 in 2017. That increased to $8.35 in 2018. And generics went up the greater of 5% or $3.30 in 2017, went up to $3.35 in 2018. So again, that's just a quick summary of some of the changes to Part D of Medicare for 2018. We do not yet know all of the premiums for Part D plans. They generally come out in October. As soon as we get more on that information, we'll include a Part 2 of this video, which will walk you through those Part D premiums for 2018. And if you want more information on how this works with each one of these phases, you can check out my video. It was about 2 years ago that talked about Part D of Medicare and each one of these phases. The other changes coming in 2018, this is a big one if you happen to be in these income brackets. There's these income-related monthly adjustments. They're also called IRMA or IRMAs for people that are making higher income levels. These exist today, and folks have to pay more for their Part B and Part D premiums to the government because of these IRMAs. The change that's coming in 2018 is basically going to reduce the income levels for these tiers, for some of the higher level tiers. So folks that are in these income brackets, as an individual between $133,500 and $214,000, or as a joint or married filing jointly, between $267,000 and $428,000. Those are the folks that are going to be impacted. If you're not in these brackets, this change will not impact you for 2018. So what is the impact? Well, here's how these Part B IRMAs work. This is for Part B. I'll show you Part D next. In 2017, there's these 5 income level tiers. The first tier, which is the base level, which most folks are in, as an individual below $85,000 or as a couple below $170,000, these folks pay the base level premium for Part B, which this year is $134. Some folks are grandfathered into an old provision, which would keep them at $109. But bottom line is, if you're in this first income bracket, you're really not paying what's called an IRMA, or income-related monthly adjustment. Then we have these other tiers, tiers 2 through 5, where if you're in a higher income bracket, you are going to pay a higher Part B premium because of that IRMA, or income-related monthly adjustment. Okay, so this is how this works today. All right, in 2017, these are those premiums that individuals have to pay based upon their incomes. In 2018, we don't know yet what the Part B premiums or the Part B IRMAs are going to be. What we do know is that these tiers for 2018 are going to be changing. This is based on a bill that was passed in 2015 called the Medicare Access and Chip Reconciliation Act of 2015, or MACRA Act of 2015. And basically, the whole purpose of this act was to help sustain Medicare for the long term. And there's a lot of changes about how doctors get paid on Medicare. But this was also one of the changes that came out of this bill, was to drive more income into the Medicare system by reducing these income tiers for individuals. So essentially, if you're in one of these first 2 tiers, you're not impacted by these changes in 2018 because they're going to remain the same. It's these top level tiers that are changing. So in 2017 it was $107,000 to $160,000. That's dropping to the top level be $133,500 for tier 3. So that's why this is where the impact starts to happen, is at the $133,500 level for a single, or $267 level for a married filing jointly couple. And then if you keep going through, again, tier 4 used to be $214,000 as the cap. Now it's $160,000 for a single and $320,000 for a married couple. So that used to be $428,000. So again, if you're below today, if you were at $420,000, which is, again, you're doing great, or you got a great income, but you'd be in this 4th tier rather than the 5th tier, where you're going to be in 2018. So I like to use an example to help illustrate this and the impact it'll have on individuals. So I'll show you that in a minute. But before I show you the example, There's also Part D monthly premiums and IRMAs. Part D is the drug coverage. So you pay a premium to the drug company for the Part D coverage. But in addition to that, if you're in a higher income bracket, you also pay a IRMA to the government. That's the $1330 or $3420, or if you're in the highest bracket, the $76 a month that you have to pay the government for the income-related adjustment on your Part D coverage. Okay, so just like with Part B, these tiers are changing for Part D as well in 2018. Same values. So if you're in one of those income levels I talked about earlier, you're going to be impacted on your Part B IRMAs as well as your Part D IRMAs. So the example that I wanted to show to help illustrate the impact this could have, if you look at a married couple making $270,000, estimating an increase of over $2,400 in their premiums to the government in 2018. That's significant, $200 a month, with just an increase starting in 2018. This is an illustrative example. This is not fully confirmed yet because we don't know the actual values for the Part B and D premiums and IRMAs for 2018. All we know is these tiers are changing. So I made this model, this example, based on the exact same Part B and D premiums that we have for 2017. So assuming they don't change, which they're probably, they may go up, this would only be even a greater increase if the premiums go up in 2018. So here's the example. If you're in this income bracket, you're in the third tier of those IRMA tables that I just reviewed. And therefore, your Part B premiums this year are $267.90 per month, and your Part D IRMA is the $34.20 a month. So basically, each person is paying about $300 a month to the government for their Part B and Part D premium IRMAs to the government. So for a husband and wife, they would be paying $600 a month today. Again, this doesn't include a Medicare supplement or a Part D plan. This is just what you're paying the government if you're in this income bracket, today. So taking this step further, based upon those changes coming in 2018, this $270,000 couple would now move into the fourth tier. So their income is still $270,000, but now they're moved up to that fourth tier of the IRMA tables. So their premiums for Part B and IRMA goes to $348,000, and the Part D IRMA goes to $55.20. So now their total per individual goes up to $400 plus per month. So for a couple, it's over $800 a month, and thus their total increase is over $200 a month, which is over $2,400 per year. So this is something we want folks to start thinking about, be prepared for, so it's not a huge shock. Although it still will certainly be a shock. That's a reasonable amount of money that's going to be increased starting in 2018 for folks that may not be prepared for that. So we want to give you a heads up. Again, this is not defined yet. We can't know for sure what the increase is going to be until they release those Part B premium values and Part B IRMA values and D IRMA values, which generally doesn't come out until November, sometimes as late as December for the following year. So this just assumes that nothing changes with those values, then we would see this type of increase coming for the folks in these income brackets. So just something to be prepared for. If you think you're overpaying on your supplements, that's something that you can give us a call about at the number below, and we could potentially help you save some of that increase you're seeing on those Part B and IRMA premiums, and maybe we can help you find a better supplement and help you save some money there on your Medicare supplements and prescription plans. So in summary, we did hit on two changes coming in 2018. One were the Part D changes for 2018, and then the second one were the IRMA changes, or income-related monthly adjustments for the tiers of income for Part B and Part D. As soon as we get more information on the other items, the Part B premiums and deductibles, Part A deductible and copays, and the Part D premiums, we will release another video and explain what those changes are going to be as well, so you're informed there. If you have any questions, you can always give us a call at the number below. You can follow us on Facebook for additional updates, or subscribe to us on YouTube for additional videos. And have a great day. Talk to you soon.